Well, hello everyone. As you know, we've got one confirmed case in Ontario now and a presumptive second confirmed case. And so I'm here to answer questions that you might have.
Is it your sense with the two cases that we have, we know there are a couple, or were they both contracted in China? Is there any sense that it might have spread from one to the other back here in Canada?
At this point, I don't have that information. What I can tell you, though, is it is a sign that the information that we're providing and the collaboration that's happening across all levels of government is working. In fact, the first patient knew exactly what to do should his symptoms mirror the kinds of symptoms we were asking passengers to watch for. And of course, his spouse was in self-isolation as directed by health officials after he was hospitalized. And so this is, for me, a very good sign that Ontario is taking all of the precautions that it needs to take to ensure the limited spread of the disease.
The Ontario health officials said today 2 confirmed or presumptive confirmed, 16 ruled out. I think it was 19 that they're monitoring because of maybe travel history and symptoms. Do you have a global number for the country on how many cases are actively being monitored?
I'm reluctant to give that number only because it changes from day to day, but what I will say is that the fact that there are cases that are being actively monitored is a good sign. It means that our public health officials, our health officials at all levels of government, including the municipal level, are taking their responsibilities seriously, have the information that they need in order to act on potential cases, and are taking appropriate measures to make sure that we do the tests to ensure that we understand what the spread of the disease is like in Canada.
Are there cases being monitored outside of Ontario?
How important is it for people to self-report as opposed to very low?
I think it's really important that people who have traveled to China recently, who have come from the Hubei region, that are potentially interacting closely with other people who have experienced that travel recently, are taking it seriously. I think all Canadians should be taking appropriate healthcare precautions that are normal and advisable to prevent all kinds of spread of disease. So, for example, washing your hands is an incredibly effective way to reduce risks of infection of all different kinds of viruses. So there are measures that Canadians can take today to reduce their risk. But yes, the fact that information is getting out to Canadians who have traveled or who are with people who have traveled to the affected region is a very good thing.
Are there cases being monitored outside of Ontario? And are there also any cases of Canadians in China or elsewhere who are sick who are not in Canada right now?
Again, I'm reluctant to go into numbers of cases that are being monitored, as that could be very fluid and can change from moment to moment. But I will tell you that the provinces and territories are reporting cases that they're monitoring immediately to their federal counterparts, which allows us to support them in contact tracing, in testing, and analysis at the national lab.
What about Canadians overseas? There's 167, Minister Champagne says, who are registered with consular officials in China. Do we know if there are any Canadian citizens or permanent residents abroad who are ill?
So again, I have a different number, but there are a number of Canadians that are registered to have traveled to the affected regions. And yes, the minister is working very closely with the Chinese ambassador, his counterpart, to make sure that we know where those people are and that we can provide them supports to return to Canada as appropriate. And so we'll continue to do so. I will also take this opportunity to remind Canadians that there are travel advisories for the affected region on our website, canada.ca/coronavirus, and as well to register if they're traveling anywhere abroad so that the Canadian government can assist in situations like
this. Do you know of any ill Canadians abroad? Or is that not something you know?
I do not know that information.
Is there any plan to do, some countries are now evacuating their citizens from the infected region. Is there any plan for Canada to do an evac of their own?
Again, we're working very closely with our counterparts to determine, first of all, if people want to be evacuated and what their particular situation is.
Is the public reaction to the risk here proportionate? You know, when you look at the fact that there are no human-to-human transmissions outside of China, no deaths outside of China, the self-reporting seems to be working. You know, the public and the media reacting in a way that you think is the right way to react to what's going on here?
I think that's a fair question, and I think part of the challenge is communicating in an effective way to Canadians through the media, through other measures, that the risk is low. I think that is the primary message that I want to give Canadians. The risk of contracting coronavirus is low, and I think there are risks of contracting other viruses that are here in Canada that we know a lot about that are much higher. Having said that, I think the media has a role to play. I think that there are ways that we can amplify our communications, and one of the things I've asked the department to do is to set up a federal 1-800 number so that people can phone that number if they have any further questions and they are confused about how to reach their provincial health authorities.
Have healthcare cuts in Ontario had any impact on the federal government's ability to deal with this issue?
All I can say is that all appearances are that the system is working extremely collaboratively. I can't really comment about what's happened in the public health system since the announcement of a reduction of public health units, but I can tell you that I spoke with my own local health unit today. Some of you might know I worked in public health for 9 years, and so I took the opportunity to reach out to the medical officer of health in the organization that I was an employee in once, and in fact was very reassured by her sense that at the local level things are working well in my own riding, and that is the sense that we're getting all across the country. Healthcare professionals are feeling supported at the municipal level by the provinces and territories. I think this is an area where we are working very well regardless of political stripes, and it's because the health of Canadians is of the utmost priority, I think, for all governments.
You were asked a question about potentially evacuating Canadians who may be in China right now. Is it something that's on the table for Canada, a plan, if you will, to get the Canadians out of those regions because they are essentially trapped there, they're quarantined and not able to leave?
So my colleague, Minister Champagne, has been working, as I said, very closely with his international counterparts and with the embassy and with his American counterparts, and we have measures in place that can support Canadians that want to leave. We're continuing to work out those details in terms of who does and where people might be.
Was Health Canada able to get in touch with everyone who was on the flight with the first victims?
So contact tracing is done at the provincial level, although we have provided support in terms of information that they need to find individuals that were on the plane with the individual that has been confirmed positive. We provided the manifest, for example, through public health, and we continue to provide as much information as we have to our provincial counterparts.
So have you heard from them if they were successful?
That would be a question at this point for probably Dr. Tam or for my provincial counterparts. I know that work is ongoing and that they are working extremely hard to make sure that people have the information if they were on that flight about what to do next.
Do we know where this coronavirus has originated from? Is the source of it?
The research continues on how this coronavirus came to be. It's only the 7th of its kind. Certainly there's some indication that there may have been a vector of animal transmission, but that research continues to go forward.
Thank you very much.
Thank you.